I believe having access to care in neighborhoods where there may not be the economic feasibility to see a physician is important for families to live a healthy life. And so I think being in a community health center creates that equity because there is accessible care right in their neighborhood.
Community health centers have been a tremendous asset in all these communities. We're here for anyone who wants to come. And that's the whole theory of the federally qualified health centers. When I came, we were in this little storefront. We had a lunch program for the elderly. We had one dental chair that was donated by an old dentist, with your spit tube, they had the rubber bands running the drills. Downstairs was a pediatric clinic, so almost everything was there in seed form. The challenges were always keeping it alive. You know, before we had the big community federal health grant, we ran on donations and roast beef dinners and charity.
Myself and my children would be willing to serve this food that they cooked. So that's, we came and worked at the roast beef dinner. And Friday nights, there would be a gathering. First we would have Mass at St. Vincent's Church, and then people would gather at the bank building afterwards and have cookies or whatever. So that was in 1975.
When the FOR began in 1969, it was Father Fisher and Sister Paulette. And till I came around, it was Father Ryan and Sister Ruth. There was something about this place that seemed very special to me. I came here as a general dentist, and that's where I began in 1982. When I came for the interview in 1981, the building that we're now sitting in, all the conduits were coming from the ceiling, none of the walls were up, and Father Ryan was so proud to show me what this was going to be in the future. I had immediate liking for Father Ryan and Sister Ruth, and it seemed like they were very mission-driven, and they really had a dream of something that they wanted to see continue to be fulfilled.
When I applied and interviewed, the mission of the center really stuck with what I was looking for. They truly had the patient as a whole as their priority, and it wasn't just about numbers and metrics and making money, and it really was about treating people. We can really take the time for the patients and give them the time that they deserve and hopefully the care that they deserve, as opposed to just try to generate more and more revenue and more visits. FQHCs are in that unique position because of that backing from the federal government to not again have such the stress of worrying about that reimbursement from the insurance company, but also then to be placed in a position where we are available and local to our patients and allow them to have easy access to, again, good, hopefully quality care that's just like a private practice or elsewhere.
I actually love the FQHC model. As a federally qualified health center, Stowe Rocks is committed to providing access to care for the most medically vulnerable in our communities. So people without insurance, people who may face barriers to care, whether it's transportation or not having insurance, can come to a health center and receive the care that they need. See a doctor, see a dentist, get those essential services that they need. We have found that individuals that face barriers to care also face inequities as a result. Not being able to see a doctor, not being able to pursue a healthy life.
The success of our organization really does come from having the right people in place to be able to provide the quality care.
We've had some very loyal physicians.
We need to have high quality physicians, high quality staff members to be able to provide the care that is necessary for them. And I think we do that on a very nice scale.
The health center is an incredible anchor resource for the Stowe Rocks community, and there are so many far-reaching implications for that. As we unravel generational poverty and the trauma that's created through it, again, to get our residents to be able to step up that ladder, so to speak, we need the health center here to help us think through that physical and mental health wellness piece. because it's absolutely critical to the residents that we're serving.
Access is one of the most important things, and it's really a celebration of diversity and really an understanding of inclusiveness and what it means. And it's just making people feel that this is home. It's not just a place to drop your hat, it is a place to call home. And home should be loving and caring and have a round of compassion with it.
Here it is caring for the person as a whole, and providing health care with a heart really does mean providing the best care that we can in the circumstances that are best suited for that patient. My inspiration really does come from knowing that we can make even the little differences for our patients. For us, any chance that we can take to alleviate any of their burden allows for them to take better care of their whole selves.
We serve two distinct neighborhoods that have some common themes of working families who need access to care, seniors who need to see a doctor, also communities where there are organizations working together to make sure that individuals have the services that they need. When I think of McKees Rocks, I think of families. I think of seniors. I think of individuals that are working together, playing together, learning together to be as one. And that's what we're trying to do as a community. Hilltop is a beautiful community as well. When I think about Hilltop, I think about, of course, the geography and topography. You can't miss that. It really lives up to its name. But I do think because of where they're located, they do face some challenges that are unique and also isolating just because of where they're located. But again, Hilltop is a community where families and seniors are working together as one.
There's a lot of hardworking, innovative, creative people that overcome their circumstances to strive towards a better goal. And they need more exposure to what's out there. They've taken it so far on themselves. They've shown such grit and determination and love of their families. And now if we can marry that with a lot of the creativity and innovation happening around the region, the people in this community are so deserving of being connected with greater assets because they've shown a determination that is second to none.
There has been a lot of progress, and I think we're in a wonderful position right now to continue to progress going forward.
It's a strong legacy that Stowe Rocks has. If you think about neighborhood-based organizations, some come and some go. The fact that we've been around for 5 decades is a tremendous testament to the board and also the staff that work here every day to do the work that they do to advance our mission. It's a strong legacy that we want to continue to build on as we look to the future.